These are the 5 questions I get asked most often about the procedure itself. I can reveal that after 30,000 procedures and 25 years of performing laser eye surgery, these are the 5 questions, and the last one is the biggest worry. You're finally about to get your LASIK surgery. You're meeting your surgeon, and naturally, you've got some questions, things that you're worried about. Now, what questions would you ask? Okay, question 1. This is the question I get asked every week without fail. What if I move my eyes? Will the laser be applied in the wrong place? Well, the good news is that modern laser eye surgery is designed with this in mind. Now, even when you're staring at a single point, your eyes are never truly still. They make tiny involuntary movements, and these small, jerky changes in position help refresh the image on the retina so it doesn't fade. Without these small movements, your vision might disappear because your photoreceptors, the light sensitive cells in the eye, would adapt to a static image. So during the procedure, we use advanced eye tracking technology that monitors your eye movements 500 times per second. And that's faster than your brain can even think about moving your eyes. So if you do shift your gaze slightly, the laser will adjust itself in real time to stay perfectly aligned with the treatment area. Be reassured that you can't outrun the tracker. And if for some reason your eye moves too much, the laser automatically pauses until you're back in position. So even if you're nervous or you feel like you can't keep your eyes perfectly still, the technology has your back and will keep you safe. Question 2 is the question that is likely at the very top of your list of questions. Will it hurt? Well, I'm happy to say that LASIK eye surgery is surprisingly painless. Before we even start, we apply numbing eye drops to ensure that you don't feel any discomfort during the procedure. The most that you feel is during the flap creation part of the procedure, where we use a femtosecond laser to create the flap, and this gives a feeling of pressure for maybe 20 to 30 seconds. The rest of the process is painless. It's more about what's actually going on in your mind than in your eyes themselves. The entire process is over very, very quickly, usually in about 5 or 6 minutes per eye. After the surgery, you might feel a bit of dryness or mild irritation, like having an eyelash in your eye, but this is temporary and easily managed with prescribed eye drops. We do give anesthetic eye drops for the first few hours if you need them. Sometimes just go home and rest with your eyes closed for a couple of hours. Now, most people are pleasantly surprised by how easy and comfortable the whole thing is. This brings us to worry number 3. What if I blink? So blinking is actually not a problem at all. During the procedure, we use a small device called a lid speculum to gently hold the eyelids apart. Now, the speculum sounds a little bit intimidating, but it is completely painless, and it ensures that you won't accidentally blink while the laser is working. While the speculum is in your eyes, actually, it feels just like you're blinking. The muscle twitch still happens, and so just blink naturally and normally. And because your eye is numb, you won't feel that urge to blink and to close your eyes. Though one word of warning, squeezing on the speculum can cause some pain. So it is very important that you relax your face, your forehead, and let the speculum do the work. The laser correction part is fast and very precise and is usually over in around 10 seconds. This brings us to question number 4. When can I go back to work or get back to sport? This depends on the type of work or sport that you do, but most people who have LASIK are surprised at how quickly they can resume their normal activities. For desk jobs or light work, you can often return to work the very next day or even perhaps 1 or 2 days. If your job involves heavy lifting or exposure to dust or debris, I'd recommend waiting about a week to protect your eyes. For sports, it's a little more nuanced. If it's non-contact sports like running, going to the gym or yoga, you can resume those in about a week. Contact sports like basketball, soccer, martial arts do require a bit more caution. You'll need to wait at least 4 up to 6 weeks and possibly wear protective eyewear for a while. For swimming, I recommend waiting 2 weeks before going in the water and 4 weeks before using the goggles because they can exert a lot of suction. The key is to follow your surgeon's specific instructions and listen to your body. Most patients are back to their routines in no time and are thrilled with how quickly they can enjoy life without glasses or contacts. And that brings us to the most common worry that LASIK patients have. It is question number 5. Will the flap move if I rub my eyes? Now, this is an important one, and I always advise patients to be extra careful during the healing period. After LASIK, the corneal flap that we create is designed to heal quickly and securely, but it is still delicate, especially on the day of surgery. The skin will heal and seal the flap in around 4 hours, very, very fast. And this is the period to be most careful. On the surgery day, please do avoid touching or squeezing or rubbing your eyes. Now, flap movement beyond the surgery day is rare, but you should still be careful during the first month. If you do rub your eyes aggressively during this time, there is a small risk of dislodging the flap, and that is why we do give protective shields to wear at night, and we recommend avoiding any rubbing or heavy pressure on your eyes during the first month. After that, the flap becomes so well integrated with your cornea that it is very unlikely to move even if you rub your eyes. But as a pro tip, it's always a good idea to avoid rubbing your eyes in general, as this can irritate them and even weaken the cornea or possibly introduce bacteria. And what if the flap ever gets moved? It is in fact a straightforward procedure to put it back and smooth it out, so it's not the end of the world. So while these are the most common questions, they aren't in fact the biggest fears that people have about getting laser eye surgery. There are 5 bigger things that people are afraid of. So watch this video next to reveal what they are.